Thank you, Deputy Speaker. My adjournment matter this evening is for the Minister for Health, and the action I seek is to reassure the people of Mildura that TrialHub will continue past June 2025. The funding for the existing program is due to finish in June of this year, and we're urgently seeking a commitment from the state government that it will continue, because it's been a vital part of cancer treatment in our part of the world. And given the restrictions that are now upon schemes like the Victorian Transport Patient Assistance Scheme and their resistance to pay for taxis, even when we don't have public transport out to our airport, and complications like this and the length of time it takes to get reimbursed, something like TrialHub at the Mildura-based public hospital is so vitally important. People in Mildura are writing to me to ask that I push for reassurance, because there are people in the middle of clinical trials at the moment through TrialHub at the hospital that are not sure, and you don't need that added stress of knowing whether your clinical trial is going to continue in Mildura, a place that is your home, rather than having to travel to the Alfred. And I know firsthand how important this is. My mother-in-law has had to relocate to Melbourne so that she can seek her treatment for cancer at the Alfred Hospital. But many, like Lisa, who has blood cancer, and thanks to a clinical trial treatment, she's able to live a relatively normal life. She's had 2 years of travelling back and forward to Melbourne, but with TrialHub's support, she's able to live a relatively normal life. And TrialHub has been heavily supported. The Mildura-based public hospital to deliver this have been heavily supported. There's been workforce upskilling, which is invaluable to our community, communication support, and implementing the new model at Mildura-based public hospital so they can deliver these clinical trials alongside a metro hospital, the Alfred. It reduces our need for community members to travel. Because let's be honest, if you can't afford the $1,100 on average that it costs to fly, then you are sitting on a bus and a train for up to 13 hours. And anyone that is seriously ill does not want to be doing, no one wants to be doing that, much less when you are uncomfortable because you are so ill. So we are asking, of course, that the Minister for Health reassure those that are in the middle of clinical trials right now, that are potentially looking at becoming eligible for a clinical trial like the T-cell trial that my mother-in-law is currently on, that it can continue at TrialHub at Mildura-based public hospital.